My name is Rabbi Mendy Herson. I'm Associate Dean of the Rabbinical College of America, which is really the headquarters for Chabad in the state of New Jersey. And we've just completed our first year of our mental health initiative through our 64 centers around the state in trying to bring mental health awareness and strength and progress to the community. And that has been powered very much by the state of New Jersey, been very helpful, and leading that charge has been from Governor Codey, to whom we're very grateful for his friendship for decades, to Rabbinical College and Chabad, and specifically here. And we're very honored, therefore, to be able to have our former First Lady, Mary Jo Codey, who actually I remember in growing up in West Orange, I think societally, to my memory, led the charge of bringing the needs of mental health and the struggles of mental health, which were, at least from the way I saw it, and I think many others saw it, was really in the shadows, and bringing it out to the truth of sunlight. It really, really helped people to acknowledge and to be able to treat and have society be more sensitive to it, and people to actually step up and get treatment and recognize this is just something that needs to be dealt with. So we're very thankful to you, First Lady, and we're very thankful to Mrs. Hannah Weisberg, who's an internationally known author and lecturer and an interviewer, to be able to be here today with us. I'm going to step back and allow this to go on. I will be on, but we're all looking forward to this interview and allowing this to be a tool to help others to get closer to maternal health. Thank you.
Thank you. Thank you so much for giving us the opportunity to do this program. So my name is Hannah Weisberg, as Rabbi Herson explained. I'm the editor of thejewishwoman.org, and which is a site for all about women's health and wellness and a Jewish perspective on womanhood. And we are here today we are honored and grateful to be here today with former First Lady Mary Jo Codey, who's going to tell us a little about her experience with postpartum depression and maternal wellness, and why this has become such an important calling in her life. So thank you for joining us, former First Lady. And we are
Thank you for having me.
So privileged and honored to be here with you. And it was great chatting with you before, just on a personal level, as I think all mothers can do that. You know, anytime women get together and anytime mothers get together. And we're also both grandmothers, so we have a lot in common there. So,
right.
So it was really nice chatting with you. And now you're going to tell us a little about your story. So you married young, and you described how you always looked forward to having a baby. And yet, when you became a mother, it was followed by a really difficult time, a period of postpartum depression. What was that like? What was it like to feel that way?
I never expected to have postpartum depression. In fact, in 1984, postpartum depression was unheard of.
So
I remember being so excited when I woke up in labor, because I knew within 24 hours I'd be holding my baby.
Wow.
And we decided to name him Kevin. And yet when Kevin was born, the nurse tried to give him to me, and she said, would you like to hold him? And I said, no. So she said, you want to hold him. And she gave me the baby. I had no interest in the baby at all. I thought it was because I was just tired, but I was also very withdrawn. And that was the first red flag that something was really wrong. As time went on, the depression deepened, and I thought there was something wrong with me that didn't surface until I had a baby.
That's very interesting. I just don't want to interrupt you for one sec. So you felt really something was off the moment you really had the baby.
Exactly.
It's not like it took time for the hormones to set in or to kick in, but this was like instantaneous.
Instant.
I didn't realize that could happen.
Yeah, right away.
Wow.
And I'm not exactly sure when it was, but the American Psychiatric Association reported that 80% of new mothers will experience some kind of mood disorder after giving birth.
Mm.
And there's a whole spectrum of disorders she could have, and I had them all.
Wow.
One was sadness and weepiness, mood swings, sleep and appetite disorders, feeling worthless, feeling suicidal. And she could have intrusive thoughts, feelings that you could harm or even take your baby's life.
Wow.
And unfortunately, as I said, I had them all. And it was extremely difficult for me to have those thoughts about hurting my son. And I had them 6 or 7 times a day and night taking care of my baby.
It was continuous. It was continuous.
It was continuous every day.
Every day. And was it like swings in mood, or was it constant? Like,
it was constant. It was debilitating and constant. And those intrusive thoughts about hurting my baby were terrified. Like an example of an intrusive thought and how horrific they are would be, I'd be giving him a bath and the intrusive thought would come, smash the glass on the side of the sink and cut the baby's throat. And I imagine the bath water all red with blood.
mm-hmm.
And thoughts of suicide were a comfort because I knew the baby would be safe for me. And I remember it was extremely hard to feel like I was worthless and not a good mother. That was really hard for me to face.
For sure.
That I failed at the one thing I wanted to do my whole life. And the combination of feeling worthless and thoughts that I could harm my son at any minute made it very difficult not to commit suicide. But instead of suicide, I chose a psychiatric hospital. I was going to go to a psychiatric hospital, I thought, for life. And I was on our way to the hospital. I was in a state of panic about worrying about the baby. I was like terrified that the baby wasn't going to get the right care.
Did you share with people what you were going through? Like, what?
No, I just told my husband.
So you told your husband, and you told him that you wanted to go to the psychiatric hospital?
Well, for life. I just figured I would live there.
Oh, wow.
That was because that was either that or suicide. So I chose the hospital, figuring eventually he'll get over me. And all I could think about was what kind of wife and mother he was going to have for the baby, for the baby. Like, who was he going to marry? And I didn't care about the wife. I cared about the mother. What kind of mother was it going to be? Sure. And being like a kindergarten teacher, I knew that there were people out there that weren't good mothers. Mm-hmm. Like, I've seen people that weren't good mothers. They just weren't good for young children. And I was so preoccupied with what kind of mother Kevin was going to have that I kept saying to my husband over and over, you've got to find a good mother for Kevin. Mm. That's all I cared about. And I told him I took good care of him during the first 3 months of life, despite the depression, and physically and psychologically, he was doing good. He was a happy baby.
Wow. So this was 3 months that you were enduring these kind of thoughts and these kind of feelings.
Yes.
And so you're driving to the psychiatric hospital.
Yes, which was down the shore. Okay. And I told my husband it was up to him to continue to keep the baby happy and healthy. And all I did was worry about that. My husband was driving, and with the other hand, he was holding on to me and he was crying. Mm-hmm. And I was too numb to cry. I was also in a state of panic, worrying about the baby. And then I remember being admitted to the psychiatric hospital, and the head psychiatric nurse said very coldly to me, stand on the scale. So I got on the scale and she said, you're 29 years old. And I said, yes. And she asked, you just had a baby? And again, I answered yes. And then she said, looks like you were used to having a lot of freedom, my dear. She said to me very coldly. And I knew that was not it at all. She just left me standing on a scale asking me these questions. Wow. And that comment that she made deepened my shame. I figured if she was the head psychiatric nurse, she must know that I needed freedom. I also discovered that I would only be in the psychiatric hospital 1 month because that's the time of that my insurance would cover. Mm-hmm. And I left as depressed as I was when I was admitted. So it was rough.
So that didn't help at all?
No.
Wow. So what made you better? What happened?
Well, like after a year of torment, of psychological torment, I was taking care of my baby for the whole time with those thoughts, fighting them all the time.
That's horrific.
After a year, they were able to find the correct medications for me, and slowly the postpartum depression lifted. And then I was able to enjoy 3 great years of motherhood with Kevin, and I desperately wanted another baby.
Wow.
And
So you were seeing like a doctor, a psychiatrist who
yes, the whole time.
the whole time, but they couldn't find the right medicine that was until a year later.
It took a year.
Took a year. Wow.
Yeah.
Incredible.
And that's not uncommon. Well, people people tell me about their depressions all the time because I had gone so public with it.
Mm-hmm.
And it's not uncommon to take a long time to find the right meds that will work for you.
Did you realize as you were looking for it that this was just a medical issue, that this was just that you
I blamed myself for the whole thing.
You blamed yourself.
I blamed myself for the whole entire thing.
And I would imagine that that's pretty common, mothers blaming themselves for what they're feeling.
Feeling worthless and guilty, and they blame themselves.
Wow.
We went to this, my husband and I both went to the psychiatrist to ask for her advice. And she said, go for it. She said, some women don't have postpartum depression after their additional pregnancy. She told me to discontinue my antidepressants because the antidepressants that I was taking were not safe for an unborn baby. So without my medication, the depression pounced on me again. I was 2 months pregnant with my second son. We named him Christopher. And again, it was severe. I had to get 11 shock therapy treatments while I was pregnant. And each week when I would get a treatment, I would think maybe after this one, I'll be better, but I never was. But that doesn't mean that shock therapy is bad. I know some people who have done very well with it. And it doesn't work for me. But I would never say anything negative about shock therapy.
Right.
So
that was during your pregnancy with your second child, with Christopher, right?
Mm-hmm.
And what happened once he was born? Did things get worse, or
no? When he was born, they gave me my medication right away in the hospital, and I couldn't figure out when I had Kevin how people could get up and walk to the nursery. And I was able to get up and walk to the nursery and get Christopher. I was so happy. I was so proud of myself. I was so happy to have Christopher. It wasn't the same experience that I had after I had Kevin. I couldn't figure out how anyone could do anything.
Wow.
So
it was really just during the pregnancy with Christopher that you were feeling it again.
Without my meds.
Without your meds. And once you had him, you already had the medicine that you needed to take, and things were better. Wow. Wow. So, in 1993, you decided to go public with your story. What motivated you with this decision, and what was the reaction that you received from people?
I decided to go public with my story because I realized that anyone who wanted a baby as badly as I did and could get depressed that quickly, it had to be an illness or a disease. Like I had everything a new mom could want. I was so depressed, I couldn't function, and I had everything. I knew that if it was a disease or a mental illness, other mothers were going to suffer from it. Because there was such a lack of information on the subject, they were going to be in trouble because they were going to need help, and there was just nothing out there.
So true. There really was nothing then in those days.
So I think Kevin was about 10 years old when we decided to call a reporter. I thought I would be discriminated against from people who never had postpartum depression or any mental illness, and I was prepared for it. But I had to prepare my husband. And I said to him, when we go public with this story, people won't like us very much. But I told him the people who matter, the women who had it or will have postpartum depression or any mental illness, they will be so grateful and we'd be helping them so much.
Absolutely.
But people didn't dislike me. That never happened. We did this story, I remember, in the summer, and I brought Kevin and Chris back to school after the summer vacation. Most of the parents came running up to hug me. My husband and I had launched a program entitled Postpartum Depression, Speak Up When You're Down. And it was very well received. I never expected to get appreciation for that. Many parents would come over to me and say things like, you didn't have to do that, but you did, which was really nice. I thought that was really nice.
That's beautiful. That was really brave of you. Why do you think mental health is such a closed subject? Why do you think people are so insecure about sharing it?
I wish mental illness,
some barriers in terms of your sharing it and making it more public.
I wish mental illness was not such a closed subject, because people die because it is.
Absolutely.
When you're depressed, you feel often hopeless and you don't think there's any help for you. Today, there are many different kinds of antidepressants available and many great healthcare professionals out there that could really help. I'm living proof of that. You just have to be patient while they try to find the medication that works for you. Or if needed, you could have shock therapy treatment. What we need to do is have our legislators, people who have influence, as well as people who have suffered from postpartum depression or mental illness, talk about it. My husband was Senate president and eventually became governor. And then I knew I had to speak out about it. I just felt I had to do it. I didn't want to see any human being suffer the way I and my family did. It was awful.
Incredible. So you took a very personal topic that must have hurt you tremendously and given you tremendous anguish, and you decided to use it as a tool to teach people and to teach the public.
Mm-hmm.
And I guess you could say you took the darkness and you shone a light on it. You used the darkness for growth, which is beautiful. I mean,
thank you.
Yeah, that's really, this is, in Judaism, we talk a lot about our struggles and our challenges and how we need to take the struggles and challenges and learn from it or develop it and grow from it rather than succumb to it.
Mm-hmm.
And I think this is a real example in you doing that and going public and sharing with the world what it was like, and especially in a position of power like you had, to teach people that it's normal to have this and you need to for it. What was your husband's reaction to going public? Was he okay with that?
He was okay with it. He knew that, it might be tough for us. I thought people would burn signs on our lawn.
Wow. Well, I think you only thought that way because in those days, mental health was such a taboo subject.
Yeah, and then to wanting to hurt your baby, you have to be a monster.
Right.
I was like, I really wanted to love him. I really did, and I couldn't.
And you're such a loving person. You were a kindergarten teacher and you love children. And this is what your goal in life had been. You always wanted to be a mother and you weren't feeling it. Wow. What would you want to tell a younger version of yourself today? What would you like to say to yourself?
I would tell new mothers with postpartum depression not to isolate themselves. And if it gets deeper, to get medical intervention. Much more is known about postpartum today than ever before. And I would tell them to get all the help they can get to take care of their baby without the guilt. Like, forget the guilt, just take the help. And I would tell them they have the whole baby's life to be good mothers to them. Right now, they just need help, and there's nothing wrong. It is so right to get help.
As mothers, we're always giving, to everyone around us. In fact, in Judaism, the mother is called the Akara Tabayis, which means the mainstay of the home. She is the home. She really takes care in so many ways and is constantly giving to others. And I think sometimes mothers have a hard time just taking care of themselves, realizing that right now I have to just work on getting healthy myself and not feeling this, which is really what you're saying, that mothers should do whatever they can to get healthy for themselves. Because that's really what everything is standing on. And so you when you decided to raise awareness, you helped New Jersey become the first state to require hospitals to screen new mothers for PPD in 2006. I think that alone is like a huge change to raising awareness and to creating more information out there for what PPD is all about.
I think when I was in the hospital, like the day I had Kevin and after, the pediatrician came in and he saw that I was withdrawn and I had no interest in the baby. And he didn't like me very much.
Oh, wow.
He was like, she's a little princess over here. You know, he didn't like me at all. And I didn't like him because we didn't know what was going on.
So it sounds like the medical community in those days did not really know. I mean, you talked about the psychiatrist and the psychiatric ward and this doctor of yours. Seems like the medical community was also not really so aware of what this was all about.
No, not at all.
Wow. Wow. Do you think that attitudes towards mental illness and maternal wellness have changed over the years?
Let me see. I think they know that postpartum depression and mental illness exists. It's out there, and they really do have to speak up when they're down and get help. I remember when I had breast cancer at 40, there was like an outpouring of kindness from the healthcare professionals. When I went to the hospital to get chemotherapy, they would say things like, you're going to be fine with this chemotherapy. A lot of women have had it and they're doing fine. Keep the faith. And then they put me in the chair and I had the chemotherapy. Before you have shock treatment, you need to get prepped for the anesthesia. And while the medical staff was preparing me for it, they never looked at me. They didn't look at me. They looked past me to my husband. And they talk about the traffic or the weather for that day with him. Attitudes have definitely changed.
That's incredible. That's incredible. That's, I mean, you're comparing going through breast cancer, which is a huge thing.
And yet a double mastectomy. I would take breast cancer over postpartum depression any day.
Wow. That's incredible. That is really incredible. What's your hope for the Codey Fund for mental wellness? Well,
just last week, I went to my daughter-in-law with my grandchild to the pediatrician, and they had a poster in the waiting room that explained postpartum depression and the warning signs. And then I went to the gynecologist the same week, and again, they had a warning sign about postpartum depression and listed its signs. And these posters made it easier for women to bring it up to their doctors because they know their doctors must be aware of it if they have a poster in their waiting room about it. I was like so excited about that. My hope for the Codey Fund for postpartum depression and mental illness is that medical offices and hospitals will be able to reach more patients by integrating maternal mental health with general women's health. My hope is that OBGYNs and pediatricians won't be afraid to talk to the mothers about having mental illness or difficulties after their birth.
It's so important.
As for mental illness, I hope that for both men and women for the Codey Fund, my hope is that part of a regular physical exam, physicians will always include the patient's mental wellness as part of their appointments. My hope is that patients themselves will be informed through the media and interviews like this one, and will never take questions about their mental health as an insult, rather a help. And people and their doctors, I hope, their upcoming appointments will be asked about their psychological well-being. And maybe they'll take even referrals from the practitioner for help without feeling the shame. But despite having horrible postpartum depression with both of my sons, I still could be and was a wonderful mother to my sons. In fact, the other day I said to my son on his 37th birthday, do you realize that because of you and your birth, you helped so many women? And he's so much taller than me. He just smiled and patted me on the head and said, glad I could help you, Mom.
He's not only helping you, he's helping women worldwide.
Yeah,
that's
his birth.
Beautiful. Wow, that's really beautiful.
So we celebrated his birthday.
Incredible.
He had a lot to celebrate.
That is a lot to celebrate. Wow. But I think it has become a lot more routine. Like I know, you go for a wellness checkup, and one of the questions I was surprised recently, they ask you about your mental health, about how you feeling. And that's, have you been depressed in the last 2 weeks? Things like that, which I think raises that awareness, which is so incredibly important.
Hmm.
How can a woman know when she's suffering from postpartum depression, and when should she seek help?
Well, when she has any of the warning signs that I had mentioned before, like not being able to eat or sleep, having scary thoughts about hurting your baby or yourself, that's time to go to the doctor, a psychiatrist,
So it's
because
not just like this feeling like overwhelmed, which any
a
new mother.
lot of moms feel overwhelmed after having a baby. I mean, really, it's a very hard job.
Sure.
And that's not necessarily postpartum depression. That's really kind of normal. But when scary thoughts start coming into your head, I mean, that's time. It's time to get help, not to handle it on your own.
Right.
Too many women back then would take their lives. I mean, like I would go to different hospitals to talk about it, and they would have professionals who deal with women who had postpartum depression. And they said, I know, well, I don't know, but they said that one mom had been run over by a train. One woman jumped off a roof. I mean, these were educated and well-respected people in their communities.
Sure.
And they were doing things like this. And I understood why.
Absolutely. So it's an illness that could really affect anybody. It's not just, certain people. It's something that
everybody's prone to it. I mean,
and the most put together, organized, woman who looks like she has it all, which I'm sure you look like, the picture of perfection, yet this affects people of all kinds. This is something that has to be addressed for all women.
All women, right? Young, old, first baby, third baby. It doesn't have to happen with every birth, but it could, like it did for me.
I guess, and it could happen with some and not with others. So like
right.
It'll be your first, but it might affect you later on at a subsequent birth.
Right.
Wow.
Like, don't think because I had a baby and I didn't have it, I won't get it.
Right.
Because it could happen. Right. Unfortunately, it could happen.
Right. You mentioned before about isolation. How can we try as a community to have a more supportive role for mental wellness and specifically maternal wellness? Like, what can we do as a community?
Well, I think that when women get together in a support group, you could have a support group anywhere. You don't have to have it in a hospital. Right. But if you have a support group with other new mothers, I mean, like I remember when I had Kevin and he was 2 months old, I had a lot of mothers that were just had new babies, and we as a group would take them to the town pool. Mm-hmm. And I remember playing with Kevin, being so depressed. So I was lonely because everybody else was so excited that they had their babies and they were talking about toys and formula, and I was a mess. And then I remember the baby Kevin was swimming behind my legs, and I thought, push him under the water, no one will know until it's too late. Like my life was wrecked. And then I decided I was going to commit suicide that day.
Wow.
So I just went through the motions of taking care of Kevin, and I happened to have a psychiatrist appointment that day. And when I went to the psychiatrist, and I wasn't listening to anything she had to say because I was going to kill myself. She said to me, "You're not listening to me." And I said, "I've been listening to you for like almost a year now." Well, no, a couple of months, but it was every week, sometimes twice a week. I said, "You can't help me." And she switched me. I was going to take all my antidepressants in my yogurt that night after dinner.
Wow.
And then she admitted me to the psychiatric hospital, which was a waste.
That was when you
that was way back when, though. I would definitely recommend a psychiatric hospital because you need help. But that's when I decided, instead of killing myself, I'll go to the hospital, like she said. But if I hadn't had that psychiatric appointment that day, I would have killed myself that night. Wow. Just to save the baby.
Sure, for sure. So as a community, what can we do?
We don't have to assume anybody who had a baby is happy. I mean, if you could just go over to someone who had a baby and ask how they're doing, not what formula they're using, not what baby toy is good. Ask how they're doing and tell them, sometimes when women have a baby, they don't feel psychologically well after that. So it's not your fault. I mean, if we as a community could get it out there that it's not your fault if you have depression, it would be so much better than it is, it was back then.
Absolutely. Wow, that's incredible. What are your final thoughts that you'd like to tell women out there?
I think my final thought is never take having a baby for granted. It's a beautiful and wonderful gift. And you'll feel it. Just give yourself some time.
Time.
Like, I mean, a baby's a wonderful, wonderful thing. And you'll feel it eventually. If you don't feel it right away, don't beat yourself up.
Right.
Just speak up when you're down.
Right. How do you, what do you do with, I mean, you have now grandchildren,
Mm-hmm.
and are you supportive with each, is it a daughter-in-law or daughter or son?
Daughter-in-law and my son, Kevin.
Okay.
I have a baby that's 4 and a toddler that's 4 and twins that are 6 months. And when she had twins, I looked at Danielle in shock because she was doing so well. She didn't have postpartum depression, and she was doing, I thought she would definitely have it because that's so much work. That's so much responsibility. And she was fine with it. And I go over there all the time and help her with everything. I mean, like if she needs, I know there's a baby formula shortage out there now, and she has twins. I said, just that would throw me off the deep end. But like every store I go to, I look for the baby food, and anytime she needs me to watch the babies, I'm here. And I remember I got a little depressed when I retired because I had taught kindergarten for like 30 years. I miss the kids. So I said, I'm not going to sit home and miss the kids. So I applied to the Goddard Center, a nursery school, and I love it there. I just work there part-time, and I just love it. Like, and back then when I had postpartum depression with Kevin, I just thought I'm a bad person and I'm a monster. But I still, after all these years, still love kids.
Sure.
Yeah. Yeah.
So I guess as people, we can just all be there for one another. We can
all be there for one another.
Love your fellow as yourself really means just finding out how your fellow is doing. How are they feeling? How are they faring?
Contact them.
Call them. Be there for mothers, especially when they just
moms. Text them. Anything.
Right.
Just don't leave them alone on their own. And moms, don't isolate yourself. Take all the help.
Isolate yourself and realize that there's help out there. It's not you who's at fault. It's just a monster of a disease that has taken you over, and there is help out there for you. Okay, thank you so much.
So today.
Thank you so much, former First Lady Mary Jo Codey, for sharing your story with us, for sharing your time with us, for the public work that you've done on behalf of women and on behalf of maternal wellness to increase awareness and to increase just that there shouldn't be this stigma attached with it, that people can actually get the help that they need, and to realize that there is a better tomorrow when you do get the help. So thank you so much for all that you've done for
you're welcome.
Maternal wellness. Thank your son for being the catalyst for it all.
Thank him.
And thank you, Rabbi, for having this program today. Thank you, Rabbi Herson.
Thank you. And on behalf of this New Jerseyan, thank you, First Lady, for everything you've done and what you're doing to help this very, very vital. We're talking about maternal mental health today, but I know you're advocating for all types of mental health. And thank you, Mrs. Weisberg, and I really do hope that this video is going to be a tool to be able to deepen our awareness and our commitment.
I hope so. Thank you for having me. It was my pleasure.
Thanks.
So nice to meet you. See you out.
Nice to meet you too, both.
Bye.